بسم الله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. I'm Dr. Tariq Madani, Professor of Medicine and Infectious Diseases and Head of the ID section, Infectious Disease section, and Chairman of the Infection Control and Environmental Health Unit at King Abdulaziz University Hospital. I'll just show you how to prepare and disinfect the skin for performing sterile procedures. And as a demonstration, we'll use a dummy that we've borrowed from the clinical skills lab at King Abdulaziz University Hospital to demonstrate to you how to disinfect the skin if you want to perform a sterile procedure, for example, a lumbar puncture in this particular case. We have two main skin disinfectants that you can use to prepare skin for procedures: povidone iodine or the chlorhexidine gluconate 2 to 4% mixed with isopropyl alcohol 70%. The chlorhexidine gluconate come in different volumes and applicators. Like this one is a big applicator for the big surgeries like the coronary artery bypass surgery or laparotomy. And you have small packs like this one for, say, taking blood culture or doing other small sterile procedures. Okay, now we'll open this dressing tray. Our nurse, our infection control team leader, Madani, will help me doing the procedure. So please, Madani, open the sterile dressing tray. Okay, now this is sterile. I'll take the sterile part from the envelope and open it. Now, I'll ask Madani to pour some povidone iodine, please. Some povidone iodine here. Enough. Okay. And now I'm using povidone iodine to prepare the skin for, say, a lumbar puncture, as an example. So you take a cotton ball, soak it with povidone iodine. Okay. But don't let it drip. Try to dry it a bit. Press on other cotton balls to make it a bit dry. Okay. And then you use the povidone iodine, starting from the center of the procedure. Say this is the side of the lumbar puncture. We'll start here. Okay. And you move it in circular motions this way, from the center to the outside. Never go back. Never do this again. Always in circular movements, going outward, going outward, going outward. Okay. So you should start from the center of the procedure area and then you go outward. And then let it dry for a few seconds. Can you open this large tray for me? Thank you. And now, after it dries, you should put the second application. Starting from the center again. And then you move outward this way in circular motions. And never go back to the center again using this handle. After disinfecting the outer side, never go back to the center. So you discard this and then let it dry and use a third application. Again, from the center, you go outward. And then you let it dry, and then you can perform your procedure. If you want to use chlorhexidine, we'll move this povidone iodine. So I'm going to show you how to use the chlorhexidine. Now, can you please open the chlorhexidine applicator? We will use the big one to show you how to disinfect the skin using chlorhexidine. The application with the chlorhexidine is somewhat different from povidone iodine. With povidone iodine, we use circular motions starting from the center, but with chlorhexidine, okay, so this is chlorhexidine. You break it, you press to let the disinfecting solution go to the applicator itself. Okay, let it with the applicator itself. Okay, and then go to the center, press hard. You see, now solution is pouring. So you use back and forth movement. Back and forth movement, not circular movement. This way. This is how you should use the chlorhexidine. Back and forth movement, starting in the center. And then you move outward. You do that, you do the center for 30 seconds. You can let it dry, and then you move outside. Back and forth movement, this way. And then you go to the other side, back and forth movement, this way. And then you can do vertical motions around the area, this way, and then let it dry for 3 minutes. If the area was wet, you should do the back and forth applications for 2 minutes and let it dry for 3 minutes. If the area is dry, you do the back and forth movement for 30 seconds and let it dry for 3 minutes. Thank you.